dragi colegi.
Dear colleagues, I will continue speaking in Romanian. We are so happy to have this opportunity. I would like to thank the organizers for having included us into the agenda. Thank you so much for including youth and adolescents in the agenda and special groups as well. We, working in the field, understand how important it is to include again into the agenda the primary prevention, because a lot of steps of a lot of secondary, tertiary treatment steps were undertaken, but primary prevention is a little bit left behind, and I will tell you why. We will discuss a little bit the figures from Moldova. The figures from Moldova. Let me see how to work with figures and slides. A few seconds, please. So you can look into the two lines from the bottom. They are the new cases. This is the level of incidence of the new HIV cases among girls and boys aged 15-24 in the Republic of Moldova. And the above lines are for the general population. The lower line is for men, and the lighter color is for girls. And we can see that in 2017-18, the difference among them was not as big. And we see that among girls, the identification is better than among boys, and this is still an issue. I refer to boys in general. And I will speak less about key groups. I am referring to the data outside key groups, because we are looking now into the general population to see the tendencies, because now the specialists in HIV say that we have to be happy that the cases do not increase, but we would like to decrease the number of cases based on the efforts from the last 10 years, and we have great success when it comes to pregnancy among adolescents. But speaking about HIV and infections, we have so many open questions still. This is why let's look into the data on boys. Second, what worries us? Why? The question why. In 2021-2022, we have a slight decrease of severe sexual transmissible diseases, especially syphilis. Working on prevention with adolescents, in the last 2 or 3 years, we have identified so many cases of syphilis as we haven't identified in the last 10 years, and this is just among key population. This is quite a worrying thing, and we see that the incidence of syphilis increases among girls especially, and we have less cases of active gonorrhea among girls, and of course it's more identified among boys, but we somehow lose boys from our vision, and actually these cases are for youth that is migrated, but not always. Something else, tendencies of using condoms in Europe. Well, in adolescents, you can see these two lines, girls and boys, the two bottom lines. This is the use of condoms among sexually active adolescents aged 15-24 from the European region. And this confirms the data presented when they say that something is happening in the European region, even with the HIV infection control. And this is the level of the entire region, and we can see a huge decrease. Well, maybe not that huge, but quite a significant amount of condoms used in Moldova in 2022. We had quite a good situation, but quite an interesting situation. We monitored constantly these indicators, and the HBC, well, at least we see the use of condoms among adolescents is monitored quite actively from 2002, and we refer to sexually active adolescents. And in 2018, for the first time, we have seen a decrease, quite a huge gap. And there were so many questions as to what happened from 2002 to 2018. The prevention of adolescence from the national HIV program disappeared. Back then, this was the national program for, there was no reproductive health. It has been recently approved. The adolescents, again, they are not included into the documents on prevention of infections, and our strategic prevention documents excluded somehow youth and adolescents. So youth and adolescents are not present in our policies. They disappeared. Definitely, we mobilized youth-friendly health services the moment we saw this data. And we now had procurements, we informed the state. Now we do have condoms, but we do not think this is enough. So the level of condom use increases, but it should have a sustainable increase, so support should be provided. Regardless of the challenges, we have to get support in this regard. And again, going back to boys, we speak about vulnerable groups, but our society is quite interesting. Girls have a better knowledge when it comes to reproductive health, but we are a patriarchal society, and boys usually make decisions. A weird situation. The girls have knowledge, boys make decisions. And I want to tell you that HBSS study for the first time in this year mentioned that in Moldova we can see that boys with better social status better use or more use condoms. So something refers to this as well. And maybe this idea should be taken into account when we develop the messages, when we transmit the messages further on, especially when we speak to more vulnerable adolescents. So there are some moments that worry us. And let's go to risk factors. The adolescents from vet institutions, well, we think that they are quite huge socially risky group. And together with UNFPA, we had some measurement. Only 13% of them use condoms. Well, girls use a little bit more, boys a little bit less. 1/3, well, 33%, and based on the interventions, this number is increasing. So they would prolong their relationship with their friend if they learn that he or she is infected with HIV. And we somehow sometimes fail to provide more information. And in 2 years, the level of intolerance decreased. But this is based on the work in the professional schools and vet schools. Work is being done, but this is a little bit late work. We have to explain everything, not when youth is age 17, 18. We have to come up with explanations much earlier. And again, the use of condoms, the consistent use of condoms, we can see quite a clear difference comparing the groups that were worked with, 66%, and the other group is much less. But I would say that in vulnerable groups where we have some delays, it would be nice to come up with trainings, because these trainings work, but of course we have to work extensively. Why am I telling you all this? It's really important to include primary prevention in the society, otherwise our key groups will swell every day. Our services, so in Moldova we have a network of our centers, 41 centers in total. They cover all the municipalities, all the districts. And the principles of being friendly with youth and having quite a complex approach, well, this is quite an integrated approach. Besides sexually transmissible diseases, we have to cover gender-based violence, mental health. Second, integrated approach refers to integrating consultation actions, methodological actions, so the entire range of interventions from primary to rehabilitation with quite an active involvement of youth. And I will not cover extensively all the characteristics. You can see everything in the slide. So these are the services that we adapt more to the needs of the youth. But it's quite a complex approach. And the moment a young person enters the door of our centers, we do not smile and that's enough. No. Youth has to know that they will have our medical services either for free or based on vouchers, that we have flexible working hours, that everything is confidential, that the staff is well trained, that they focus on youth that are in a vulnerable condition, that there is involvement, and the youth has to know that there is a continuous training program, and this is a huge thing. And you can see vulnerable groups on which our centers focus, and definitely we work and adapt services for them at our best. And you can see that all the services are based on priority issues, and here you can see only data on HIV and infections, and we can see about individual information, counseling, psychosocial assistance, medical services, referral, organizational methodological assistance. I will not speak about each of them separately because I will speak tons. In crisis situation, we developed a new series of innovative services which helped us cover a bigger number of adolescents. We had online counseling during COVID times, and now there is a chatbot where they can call 24 hours. Mobile teams started going to rural areas, to the placement centers, and the UK app. This is an application that provides quite interesting information about sexual reproductive health. More details on our activity. The number of rapid tests increased, and our services. I'm so happy that youth is again covered by our services. We needed about 15 years to include youth into our services again. And I want to tell you that during 2023 we had over 8.5 thousand tests, out of which 13 were positive. Not all of them were primary. Some of them were for the secondary time brought. We had 100 positive tests on syphilis. 1/3 were identified by 2 mobile teams, and with the support of UNICEF, now we have 5 teams with UNFPA as well. Trichomoniasis, gonorrhea, chlamydia. You see how many STIs identified, and yet we are speaking about large use of condoms. And during COVID, we had red zones or no cross zones, so we would place condoms outside this red zone. And we have a great vending machine in our center. It provides consumables to the key population. And in this case, there is a question that our beneficiaries, adolescent beneficiaries, ask us. They ask, why isn't there such a vending machine for all the adolescents? Maybe at night, adolescents and youth could have access to such vending machines to enjoy their life. This is my question too. Conclusions. Having raised these questions, I want to say that HIV and STIs are still quite a challenging moments for youth, not only for the key population, and HIV prevention should stay should be preferential, and approaches have to be youth tailored, and we have to be able to provide complex services. As for PrEP, there is quite an interesting question. Now a lot of new approaches are covered, so now we are at a time that we can provide diagnostics, and it was more difficult to introduce this young person into the system to receive treatment. And maybe we should rethink the approach so that the first treatment to be provided the very first day when the person is being tested. It's nothing if the person takes a pill without knowing the results of the test. And yes, we have legislation developed, but the reality shows that we have not the best level of knowledge, especially in risk groups in rural areas. We still have a lot to work in this regard in order to have definitely complex sexual education as needed, with the capacity of critical thinking and so on. The implementation of new innovative preventive models to cover more youth. I referred to vending machines, the possibility to self-testing, and a better cooperation among different actors is needed. So we need to join our efforts. So this is the application. You can download this app. It has great info about sexual reproductive health, also on HIV prevention, and you can see how youth can find the nearest clinic, where and how to get tested. This is quite an innovative thing. Thank you so much for your attention. Thank you so much for having included into the agenda the need to prevent HIV among youth and adolescents. It's undoubtful that focus should be on key population, but let's not forget about general population. Thank you.